Well, good afternoon and welcome to our Lunchtime Learning. I am Darlene. I'm the program manager with Cancer Support Community Central Ohio, and we are thrilled today to have Sonia Alcott, who is a registered nurse with the Ohio Health, and we are greatly appreciative of her presenting, but I don't want to quit. It's tobacco use prevention and cessation. So welcome, Sonia.
Thank you. Irene, do you want to put your camera on so we can see you? And you can keep your, if you want to unmute yourself. So a lot of this will be interactive as well. You're still on mute. There you go. Hello. Nice to meet you.
Thank you. Same here.
Oh, you went back to
I don't know what happened. Okay.
That's all right.
I'm not savvy on text, so I'm sorry.
No, you did perfect. Perfect.
I mean, this morning when I was in mindfulness, I mean, I keep on coming and going in and out and in, and I'm not even touching my iPad. So I don't know what's going on. I think my husband is making trick on me. I mean, his spirit making trick.
Maybe. There's something to that. So again, my name is Sonia, and the way I typically do this is you can ask questions at any time or clarifying, or, you know, it's very much an interactive presentation. And there's quite a few slides, but some of the slides we won't talk about as much. And if you have time, I'm able to go over a little bit over 1 o'clock to give you the full hour, if that's okay. So today, a lot of times people will say to me, but I don't want to quit, hence the title of the presentation when it comes to tobacco. So one of the things that I really look at is we talk about how to become a non-tobacco user, how to recover, move away from tobacco addiction, what are the barriers to not using tobacco anymore, health benefits, nicotine replacement options, motivational exercises and techniques for stress management, because those are kind of the big things with tobacco cessation. So one of the things I like to ask is, you know, we look at what is your smoking history and what your willingness to stop smoking, but also look at what have you already tried when it comes to cessation? Have you tried individually, group, other approaches? And then, you know, one of the things we're going to look at also are the 3 A's, the avoid, alternatives, and adjust. So this is something that I added to my class some years ago, and it still remains true, that tobacco is the single greatest preventable cause of disease and premature death in America today. And a lot of times people will say, oh yeah, lung cancer. No, there are so many other reasons, you know, the lung disease and such. So I put that in here because it is something that is preventable. So why quit? And so tell me, so Irene, are you a current smoker?
No, I stopped a long time ago.
You stopped a long time ago.
Yeah, I started smoking when I was in college. Why? Because everybody seems to be doing it. So, you know, you just go with the flow. But then when I came to the States, I probably would buy a pack, but that pack will last me a month or more. So until now, maybe the last 3 years, I never even just one single. It's just the taste is no longer, you know, it just so I didn't like the taste anymore. And plus I have asthma. So that, you know, that really made me think twice on what I'm doing to my lungs.
Absolutely.
So now it's funny because when I'm sitting waiting someplace like in the airport or someplace like, you know, places where people can smoke, and I said I get irritated to just smoke, you know. I would either go out or tell them that I have asthma and I can't tolerate smoke.
Yes, I understand. So how long has it been since you quit?
Oh gosh. So I started when I was young, maybe I was 21. And it's probably been 40 years ago. I'm 73 now. But that between that, I was very heavy smoker when I was in college.
Mm-hmm.
But
Okay.
after that, as I said, when I came to the States, I started slowing down until it finally grossed me. So
Mhm.
it up.
I had the same experience, Okay, so if you know anybody who does need to quit, these are some of the things that people say, like, when we say to them, it'll be good for you to quit. It'll kill you if you keep smoking. You have to quit. I want you to quit. Isn't your family important to you? How do people act when we say those things to them? A lot of times we get the whole, hey, I'm pushing you away. This isn't what I need to hear. I know those answers. So instead, what we look at is we look at what are the top reasons what people, that people give to quit nicotine. Physical gain, physical fitness. That's what people say. I need to save money and I need to do better with my health. And then I like to update the lung cancer statistics. And these numbers have actually gone up in the last 3 years from a previous presentation. But currently in the US, according to the American Cancer Society, we have approximately 740 new cases of lung cancer, which is an increase from 2017. And you'll see that men and women are actually pretty close, with women just a little bit higher. And when you look at the men, the deaths has actually gone down a little bit, but it is still a bit higher in men and a little bit higher in women from previous. And then in Ohio, deaths from smoking per year are just over 20,000. And we have almost 2 million adults in Ohio that smoke. We also have an incredible number of teenagers going down in through 6th grade that are smoking as well. And they're picking up, they're vaping, and they're picking up a habit that they are just much too young for, because again, they think that they're cool. And you and I just talked about that. I think I had my first cigarette when I was 11, and then I continued because I became the cool kid. I don't think I was very cool now. So again, why quit nicotine? You have the hazards of using nicotine in any form. People say, well, I just use chewing tobacco. I vape now because it's better for me. It's really not. We look at the hazards of secondhand smoke. Sometimes people will say, well, you're not the smoker, so what does it matter? You've already talked about your asthma being in a close association with somebody else, how it's irritating and hazardous for you. What are some different diagnoses? Is it, COPD? Is it asthma? Is it another lung condition that somebody needs to think about? And then financial reasons. What are the possible savings? In some places, cigarettes are $15 a pack, or in Kentucky, I think is still the lowest in the country, where tax is so minimal that you can get a pack for like $4 or $5. And I think at last count here in Ohio or Franklin County, I think it's about $8, between 8 to 10, depending on the type of cigarettes. So.
Sonia, I have to say that with the secondhand smoke, I experienced that in my own life. My mom has emphysema and I have asthma, and my dad was a heavy smoker. In fact, he passed from small cell lung cancer, which I'm positive came from lifestyle.
Absolutely. And I talk about my mom kind of midway, and just some of the issues that she had as well. Similar, secondhand smoke, that's and where I came in, and I just decided, like Irene was saying, the taste, the smell, I just finally had to lay it down and not do it anymore. The tobacco products, equivalency to cigarettes. A lot of times people think that smoking a menthol cigarette is better for you. No, that is equal to 2 regular cigarettes. A
Wow.
dip, where somebody puts it inside their gum line, that is equivalent to 3 to 5 cigarettes. I had a gentleman in a class a couple of years ago, and he's like, well, I just smoke one a day. And I happened to ask, well, what brand do you smoke? As we were all talking, it was like, well, I smoke a black and mild. And I said, well, that is equivalent to 10 cigarettes. And when he realized that he was smoking a half a pack a day in one cigarette, small cigar essentially, he said, when that was the first class, when he came back for the second week, he had already quit.
Wow.
It was such a mind explosion for him. I mean, the rest of the class, he just sort of sat there, and you could just see he was mulling over, oh my gosh, I thought I was smoking one a day. Because he's like, I don't have a problem. I'm just here because I need the insurance. But, he was thinking about his young daughter who was under a year old. And he's like, oh, I smoke outside. I only smoke one a day. And then when he came back in week 2, he never, I followed up with him after the class, and he never smoked again.
Wow.
So, but, a lot of times people will see this and they go, oh my gosh, one of those e-cigarette pods, so a vaping pod, is equivalent to a pack of cigarettes. And people don't realize that either. They think that it's much, oh, it's several packs. No, it's a pack of cigarettes. And if you're smoking all that in one day, you're doing the same. So when we talk about risks of tobacco, and I'm going to make this a little bit bigger, is, a lot of times people will think, well, it just affects my lungs, or it just affects my mouth. No, it affects anywhere from head to toes. And a lot of times people don't realize that. So we're looking at, risks of stroke, risks of blindness. It interferes with your diabetes. You have dental decay, oral cancers, your whole airway system into your lungs, but also the esophagus, your trachea, lungs. You can also be at risk for different blood cancers, stomach cancers, liver cancers, and diabetes, reproductive issues. So colorectal issues, arthritis, immune function, hip fractures, so osteoporosis. So it doesn't just affect from when you first breathe into your lungs and out, it affects the entire body. So we also have compromised veins, arteries, blood flow, all that comes from these risks with tobacco.
Wow, I had no idea.
So then we also look at the impact on others. So a lot of times people are like, I'm the one who's smoking. How does it impact others? But as you mentioned with your dad and your mom and yourself, but the decision to quit smoking, it says here, will protect the people in your life. Smoking harms both you and the ones that you love. And that is not just with secondhand smoke, but we'll also be talking about thirdhand smoke. So one of the things that we look at here is, how does my smoking impact others? So secondhand smoke is that combination of smoke that comes from the cigarette, but also the smoke that you breathe out while smoking. And when a cigarette in itself, so as you're smoking your cigarette, that's got over 7,000 chemicals in it. Right there, just one cigarette. So when you breathe in, then when you breathe out, that secondhand smoke has over 4,000 chemicals. So it's still an incredible amount. And so one of the best ways to protect your family from secondhand smoke is to quit smoking. And I just didn't even realize the effect even on my life until later, once, my mom had moved to Ohio and had, quit smoking. And as we were unboxing old boxes of hers, we were opening them up and looking at her items, and just the smell, the yellowness. So For adults, you have breathing the secondhand smoke over time can lead to cancer, heart disease, breathing problems, the asthma, COPD, even in somebody who doesn't smoke, harder time getting pregnant, colds, flu, irritation. So a lot of the same health problems that you have for an actual smoker can happen to somebody else with secondhand. Other ways that smoking impacts others is you may not realize it, but the smoking affects the people in your life way beyond health. You know, one of the exercises that we'll look to do a little bit later is that you miss out on time with family and friends because you're out smoking, they're inside talking. The money that you spend on cigarettes, and it says having more money to spend on the people you love, but it's even just spending the money on yourself as well. Setting a good example for your children. It was, when I was growing up, we didn't know that it was really that bad for you. We had an inkling. I think my mom was told in her early 40s, oh, you have the lung of a non-smoker. No, she didn't. They just did a chest x-ray and didn't see anything. So then third-hand smoke, which is what a lot of people don't think about or realize, is the residual nicotine and the other chemicals that are left on a variety of surfaces. So tables, walls, curtains, the couch, all that. So it clings to your hair, clings to skin, your clothes. So whenever somebody comes to me and they want to quit smoking, we talk about, okay, this is the time to clean your house. Do that deep clean that you've been thinking about, or having friends and family, or pay someone to do it. Wash all your clothes, wash all your linens, your curtains, to get that smell out, get that nicotine out of the house and system. And
this is fascinating that by calling, I've never heard it called third-hand smoke, but when I was growing up with my dad, you know, he wouldn't light one from one, but as soon as he put a cigarette out, he was lighting another one. So he was definitely a hard smoker. And every Saturday we would clean the house, and we'd wipe down the picture frames that's on the living room wall, and this black residue would be on the picture frames. And we knew it was from his cigarettes. But as a child, I had no idea how dangerous that was. But now as an adult, it's like, whoa, that's why I have the issues I have.
Well, and it's, and you have the health problems that are just not even from inhaling, but, ingesting. If you're smoking in the kitchen, that nicotine, the other chemicals get on top of things, or you're touching. So that's why, wearing gloves when you're helping somebody clean their house that smokes.
Wow.
Because the residual builds up on surfaces, and it can't just be eliminated by airing out rooms or just gentle wipe down. No, there's actual cleaning that needs to happen. So I bring up my mom because my mom was a long-term smoker. She started at about the age of 16 and had an incredibly difficult time quitting. And when I counted up how many times she had tried, it was at least 6 times that I know of. And she even quit for 3 years. And something that was stress led her to smoke again. And she tried all different ways. But I finally, at the age of 69, and she continued even after being diagnosed with COPD, going through breast cancer and treatment. And she smoked 1 to 2 packs a day. She only admits to 1, but I know at times it was much more than that. And she had really, did not have great family support, even me, because I said all those same things. Why don't you just quit? It's bad for you. Why are you doing that? I said all the wrong things. And, she ended up with oxygen 24 hours a day, and she had quit by that time. But I think she finally just had to make up her own mind that I'm going to do this. And she actually said to me, I have decided to quit. I don't want to talk about it. I'll let you know when I'm ready. And about 3 months later is when she came to me and said, I have quit. I'm ready to talk about it. And we did. But I think about what could I have done differently. And so I continue with my patients, with people that I meet that want to quit, I continue with, okay, how can I be supportive and not negative?
Mhm.
Those are very negative statements, the other ones.
Yeah.
So the 4 common barriers to quitting are the fear of failure, gaining weight, social pressures, coping with stress. And with the, people are afraid of I won't be able to do this. I'm not going to make it. I'm going to start smoking again. And that is one of the main things that I see in the classes that I teach. They also worried about gaining weight. And typically, I think on average, if people gain weight, it's about 5 pounds. And when we look at the health benefits versus, possible gain of weight, health benefits outweigh of not smoking. Social pressures. Oh, come on, it's just one cigarette. Let's go outside and smoke, because that person doesn't want to be alone. So we need to look at, I have people who say, oh, I don't want to tell anybody I'm doing this. I'm afraid of what they're going to say, or I don't want to be alone, so I'm just going to go out, but I'll only smoke a little bit. So we need to, one of the things to look at is, okay, what social pressures exist for this person and how can we help them cope with those? And coping with stress, with, how do we move through the stress of dealing with not smoking anymore? Because even though there's health benefits, it's okay. It's very stressful to quit, but especially going through everything with the nicotine withdrawal. So the use types, what function does tobacco fill in your life? Stimulation, you feel that smoking gives you energy and keeps you going. Handling, I want something in my hand. Is it relaxation? Is it habit? Is there a crutch? Is it for stress? The craving, the addiction. A lot of times, I'll have people do just on a sheet of paper, write down, these are the cigarettes that I smoked during the day. Just do a record. And here this was the time I smoked this many cigarettes. This is what was happening. This is how I felt. And many of the time they'll say, this and this cigarette are purely out of habit. There was no reason for me to smoke them. And if it's somebody who's not willing to go cold turkey, if they just simply want to start, gradually, then we look at, those are the cigarettes that we take away first. Mm-hmm. Do you think that you can give them up? Okay. And then we have the 3 A's: avoid, adjust, alternative. So to avoid, it's one of the best strategies. Avoid places, situations, possibly even people. And sometimes people say, well, I can't avoid my family. No, but you can avoid certain people for a period of time. Or one patient, one person we had in our class, she, instead of meeting her neighbor for coffee every morning in person, they would call each other. Because what was the thing they did? They had coffee and they smoked cigarettes. And this woman was like, I really want to quit. So she just changed how their routine happened. What are some alternatives to nicotine? Is it that somebody chews on carrots, or I've had somebody who did Jolly Ranchers? That would not be me. I would probably want pretzels or something. So we need to look at what are some cost-effective alternatives to the nicotine. What is something that you're like, what, I can incorporate that into my routine. Something different. Adjust. Making new distractions, keeping busy, new hobbies, call a friend, look for distractions when you feel cravings, just something different. This might be the time to look at doing a new hobby or learning something new, something that is different. Mm-hmm. I had one woman, she rearranged her living room so that instead of her chair being on the right side of the room, her chair to watch TV was now on the left. And the table where her cigarettes and everything sat was not at her left hand. In fact, she didn't have a table around her at all in the same way. And she just made changes. And that's part of it, the adjusting. So group activity that we normally do during this time is the pros and cons of tobacco. And I'm going to blow this up a little bit. And so we look at, what does somebody think is a good thing about tobacco? What are the not so good things about tobacco? And I tell people to be honest. You know, sometimes I say about tobacco, it calms me. I feel better after I smoke. I have the social components. And there's no wrong answer at all, because you're telling me these are the reasons why you smoke. What do you consider a not so good thing about tobacco? And when you've got a group of people, they're going to come up with a lot of the same things, but you're going to have the outliers, and everybody will kind of look at each other and go, yeah, you're right. You know, I forgot about that part of why I like to smoke. So we also look at, what do you perceive as a not so good thing about tobacco? You know, what are the bad things about tobacco? But we also look at not so good things about quitting. It's hard. I don't want to quit. I like smoking. And again, no answer is a wrong answer.
Mm-hmm.
But we also look at, what are the good things about quitting? And so, and then they say finances. I won't smell anymore. Just what are the reasons to quit? But then we also talk about reasons for staying the same, reasons for making a change. I've had people go through the class before where they said, you know, I'm not going to quit. I appreciate what you're saying, but I don't plan on quitting. But they still come every week, and they're part of the conversation, and they're part of it. You know, I've had some people where, you know, I'm not quitting completely, but you've given me incentive to look at smoking less. And to me, I take that as a win.
Oh, absolutely.
Yeah. So this is a good discussion to have and such. We look at nicotine replacement, and that it comes in many forms. A lot of people know about the patch. They know about the gums. They may not know about the mints, inhaler, nasal spray, lozenges. The inhaler nicotine replacement, I don't generally recommend that one because it's too much like a cigarette. And what we're really trying to break is that hand to mouth motion, change that habit. So, and then one of the things that I also like to talk about is how to use each of these. So the nicotine gum, it's not gum to chew. It's, you put it in your mouth, you crunch it, like say, just chew on it 2 or 3 times to get the nicotine out. Then you're going to park it in your gum line and let that nicotine be absorbed through your tissues in your mouth. And you have a little bit of a tingly feeling. When you stop feeling that after about 20, 30 minutes or so, bring it up, crunch it a couple more times, and you can put it back down. And that's something that you can do like 6 or 8 times a day. The package directions are what to follow. Nicotine patches. I've had somebody wearing a 21 milligram patch, and they're like, oh, I was so sick, I couldn't do it. I just took it off. Well, they were only smoking not even half a pack a day. So 21 milligram patch is way too much. So they need a 14 milligram or even maybe a 7. So we always look at how much is somebody smoking and what patch would be appropriate. And and if there's somebody that smokes during the night, they get up purposefully because they're having that nicotine withdrawal and they get up and smoke, then we're likely to ask them to wear it 24/7. Mm-hmm. Rotate the patches. But if they're not somebody who smokes during the night, then we'll say just take it off when you go to bed. The micro tabs or the mints, similar thing to the gum and also with the lozenges, that you're going to get it wet, moist, slip it down and park it and let it slowly dissolve. The inhalers, we talked about those, the nasal sprays. I just think anything that brings your hand up to your mouth no. So nicotine withdrawal, what are some of the things to expect? A lot of times, like, oh, I have a hard time concentrating, depression, anxiety, irritability, because the nicotine it attaches to your hemoglobin. And so it travels all around the body, but you have these dopamine receptors in your head that when they don't get the nicotine to attach to them and satisfy those cravings, your whole body is just like, I need it now.
Mhm.
And some people it's like, yeah, I feel it, but I can deal with it. Others are like, wow, this is the hardest thing I've ever done. It is an incredibly difficult thing to quit nicotine. And I say nicotine versus cigarettes because nicotine comes in all different shapes and forms nowadays. So I like to make sure that people know, like, okay, this is really what's going to happen. Drinking water, just flushing out your system can help, but just knowing that it does gradually decrease. My mom used to say, oh, you have a class starting. Tell them this. So she would give tips from when she went through it and say, okay, yeah, they say it only lasts for a minute or two. It can last 10 minutes, just the craving or that intensity. But she would also say it's worth it on the other end to do this. We talk about the habit loop, and this is really about looking at how do you change the habit? How do I change my routine? How do I change what I'm doing so that I can incorporate the new habit of being a non-tobacco user? So the craving for that nicotine can be brought on by several cues. It can be that certain time of day, or when you're in a certain location or certain people, or how you're feeling, that stress. And your brain goes into that automatic mode. And those are the dopamine receptors going, hello, give it to me. I usually yell out, nicotine, very loudly, and I scare everybody in the room. But it's really, then they'll say, we all say, like, yeah, that's really what it's like, is your body is just shaking with it. So what I always ask is, okay, when you have that craving for nicotine, as you're trying to quit, what was going on right before that urge? Was it a time of day? Was it a stressful situation? Was it something at work? Was it something at home? What was happening? Or is it a routine? So the behavior that we wish to change or reinforce, we need to look at how do we change that routine. And everybody says, well, I tried it and I couldn't do it. Well, how long did you try it for? Well, I tried it yesterday and it didn't work. But we look at how long does it take to create change? How long does it take to make that change and reinforce it? And I say, 30 days, 45 days, doing something repetitively every day. And that changing routine is to not smoke anymore. So we look at how do we make those changes. And then the reward. The brain has decided that the routine is worthy and wants it to be continued for the future. We used to have a guest speaker that would come in and talk about habit changing. And he would say that try changing how you put your socks on. If you normally put your socks on your right foot first and then your left, he said, I want you to try for the next week, put your left sock on first and then your right, and let's see how you do. I can usually, I do it like once, and then I totally forget because it's not a habit. It's not part of my routine. And my brain has said, we don't really care. But if you think about any routine, anything that you want to change in how you do or why you do it, you really have to look at, is it, how do I create it so that it is worthy to being remembered in the future? Positive reinforcement so that you're likely to do it again. And anything that has that positive feeling. Some people say, I get up and I brush my teeth because I don't want to smoke and then brush my teeth. The taste of chocolate. Somebody's like, I'm afraid of gaining weight. Okay, well, in a previous class, we talked about M&Ms and, maybe giving yourself a reward of little M&Ms, a certain amount. And then that is your reward for that time point. But having different things in mind, like, oh, if I get through this, I can watch my favorite TV show. we look at the stages of change. And sometimes people think, oh, I got this. I'm already in this stage. And then they'll come back and say, Sonia, I'm now back here. How does that work? I was here. Now I'm here. And I'll have people say like, oh, I'm good. I'm not even there yet. I'm not doing this. Or I'll have somebody say, I am ready to do this, but it's easy. You can flex back and forth between stages as you're going through this. So the first one, the pre-contemplation stage, I am not ready. And this is a lot of times when I first talk to people that their doctor sends to me, they're like, yeah, really not thinking this is for me right now. You can call me in a couple months. I might change my mind. But it's really, and a lot of times people can be seen as, I am resistant to change. I'm not doing this. I'm not ready. But a lot of times it's merely the fear of change. It's really that I am not ready and I don't know if I can be ready and I'm afraid of failing. So instead, it's really just talking to them about, tell me why you don't think you're ready and how have you created change in your life before? So then we look at the contemplation stage of, okay, I'm thinking about this change. I'm thinking it might be a good idea. I'm not quite ready to take the step yet, but I'm closer to making the change. So then we look at, okay, you're here now. What do you think you need to get to the next step, which is then the preparation stage? I'm ready for action. I'm ready to go. And the readiness for change has already started. Somebody might say to me, I've already been smoking less. I was 3 months ago, I smoked a pack a day. I'm now at a half a pack a day. And I always tell them, I'm like, that is huge if you're doing that. So then we look at, okay, what did they do to get themselves down to this stage? Action is when they are like either, and it can also be the preparation stage that they're in the class. And sometimes the action stage happens while they're in that class, that they are making changes, and that it's within that's the last 6 months. But only an actual change counts as action. So not everybody is going to stay in action. They might be like, oh, I quit, I'm good. Oh. But then 2 weeks later, they go back. So then they're still in the preparation stage. But I always talk about like, we kind of ebb and flow throughout our lives in these different stages. And we look at where they are, where they want to be, how do we get them there? Maintenance, change has happened. Working on preventing relapses, less tempted to relapse, confident in change. I've had people tell me I cannot quit smoking on this date that has been asked of me because a Halloween party is happening that following weekend and I'm going and I know I'll be smoking because of the people that are there. I won't be able to hold myself back. I said, okay, then we look at you having your quit date the following week. I don't want to set you up and send you out into the world and just be met with failure. Mm-hmm. So we look at the 5 Ds of quitting: delay, distract, drink water, deep breathing, discuss. A lot of people are afraid to tell people that they're quitting. And I always ask, I said, okay, I get that you don't want to tell anybody because it's, again, that fear of failure, the fear of if I don't make it, will they think differently of me? But I always say, pick one person at least to talk to or say, this is what I'm doing. And I tell them the story of my mom, how she said, I'm quitting. I'm not ready to talk about it, but I'll let you know when I am. And it's really about listening to what somebody has to say and choosing just somebody to be your ally, choosing somebody to be that support person. Being stress hardy is another one that, it's something that is sustained over time. It's not going to happen right away. And we talk a lot about this as, how to prevent relapses, how to deal with those stressful situations so that you're not going back to cigarettes are going to help me out, because they're really not. And people are like, oh, well, it just calms me down. Well, it raises your heart rate. It raises your blood pressure. causes all kinds of issues. Really, I don't think it's calming. What's happened is those nicotine, the dopamine receptors in your brain are saying, thank you. Okay, now we're calm. Okay. So again, it's how can we help maintain? How can we get people prepared for high risk situations so that's not what they first go back to? And, you know, being aware of overconfidence, the daily temptation, and you know, that even when they are finished with the 6-week class, or even if, you know, they quit in week 4 and they're like week 1, like, hey, I'm doing great. It's really about continuing that maintenance, continuing the work. And I mean, my mom 10 years later was like, yeah, if I could have a cigarette, I would. You know, so for her, it was something that was a daily as well. So replacing those feelings of stress with a new, healthier lifestyle, keeping up the commitment, and just being part of, I am going to continue to be a non-smoker. I like this one because we talk about the meditation, the wellness, health, exercise. How do we put this all together? And it's really balancing everything. It's a balancing act. And, you know, with any change that we want to make, getting enough sleep, stress management, positive attitude. What are your support system? They talk about eating, you know, eating healthier, you know, so that we don't, I think sometimes when we are able to eat healthier, we feel better and therefore we handle stress better.
Mm-hmm.
So when it comes to nicotine cessation, or to quit tobacco, the 2 main forms of support are pharmacotherapy, so the nicotine replacement, or, you know, we had Chantix for a while, which is currently on hold, the FDA, but you also have some different antidepressants that have been shown to really help to curb the need for nicotine, you know, kind of dampens those dopamine receptors, but also the behavioral support, which is part of taking a class, listening to this program today, and, you know, just utilizing both. There's, you know, sometimes people will say, oh, I can't believe that I actually need something help to get through this. I need a crutch. Mm-hmm. It's not a crutch. It's really just a guide, and it's helping to support you as you go through, just as somebody would support somebody else. You know, getting support as you quit, choosing your allies. It's really about, you know, whether it's 1 person, 2 people, or that you have an online forum that you go to for support, doesn't really matter to me. It's going to be what is comfortable for you. And I also tell people that if you don't feel that you have anybody in your immediate circle, that it can be your ally. You know, if you're having a difficult day, if it's, you know, quitting tobacco is hard enough, you know, call me and I will be that, or we will look at other resources for you to help you find an ally in some shape or form. So sometimes somebody just needs to have somebody listen to them, or tell them it's okay to not smoke a cigarette right now. What do you need me to do to distract you so that you don't go have a cigarette? That's what we're here for. In one of the classes, a woman who was in there, she took home this part of the class to her husband because he thought he was being very supportive of her, and he read through it as he, you know, and he read through some of the things in the very beginning of this presentation, where we say, you know, why are you smoking that cigarette? I thought you were quitting. And he said to her, he said, I have been supporting you the wrong way. And he said, you know, reading this helped him with, okay, now let me work. He had some work to do on how do I help you the right way? How do I support you in the right way?
That's cool.
So it's really about talking to people and telling them this is what I need, mm-hmm. and educating them as well. I've had some people where they have brought their spouse with them to class, and they're like, I hope it's okay. Absolutely. I want them to know what you are learning so that they can support you properly. So just, you know, doing things together. What are the challenges, and how can you help each other? Getting, so you're getting the support as you quit, choosing your allies. What are some different things that you can do to get that support? So then the one thing that really comes up is lapse versus relapse. And some people will say even having a cigarette is a relapse. It's really more of I see it more as a lapse or a slip in as you're quitting, that it can, I had one gentleman who, he had quit, he had been doing really well for 2 weeks, went to a Buckeye football party. And he came in the following week and was absolutely just devastated with himself. He said, I'm back to smoking. And we talked about what happened. And we were a larger group at the time. And he talked about what happened, talked about the party and such. And he's like, so I can't do this. And I said, what stops you from stopping today? Let's talk about that as a lapse. You slipped. You were put in a situation. You didn't know how to deal with the stress of it. You smoked. Let's have you try and stop again. And he did, because he had a whole new outlook of oh, okay, it doesn't mean the end of the world. Now let's move forward. So it just, he said, I really need to think about my situations that I'm going into.
That's great.
So it was a really good situation conversation. So here again, we talk about, if you experience a slip or a lapse, taking the time to really understand what brought you to it, why did it happen, and okay, what do we do going on in the future? And it might be not going to another Buckeye party, or if you're at that party, that you just make sure that you are not going outside to smoke, finding a different way to deal with it. Because I don't want anyone to not have a social life anymore or not spend time with friends, but letting your friends know that, I'm not doing this anymore. So again, stop, think, plan, act, celebrate. Those are the big keys of relapse prevention. And it's in here twice.
That's important.
So then we look at, the relapse prevention list, looking at, what are some different things that you need to put into your prevention toolbox. And I have here a couple of spaces where you can put in your own suggestions of, this is what I'm also going to be doing to prevent going back to smoking. And this can even be that somebody can write in their own suggestions when they're in the process of quitting and they haven't quite quit yet, but what has worked in the past before with them making a habit change or not doing something anymore. One thing that tends to get overlooked a lot is the grief cycle as somebody is quitting. And, it's the grief cycle is part of many things in our life. When we lose someone, or whether it's a person, a pet, change in life, but the same thing goes many times with cigarettes, because it is such a change. And many times when people will say, well, why can't I just quit? Well, it's taken you 30 years to fully create, sustain, and maintain this habit. And for some people, it might be 40, it might be 50 years, it could be 5, but you've taken a long time to do this. You cannot just change overnight that you are going to not be that person anymore. So then we look at, where is somebody in the grief cycle, and we've got denial and isolation. And a lot of times people will say, you know what, I think I'm still in the anger phase. I'm still in, see here, we'll talk about denial for a moment, sorry. So we talk about, I know I should quit, but I'm not sure I want to. And that's really just part of where are they in the stages of change, the state of grief, and kind of looking at, okay, this is really where I am. I'm not quite ready. I've got some more work to do. I have people who are just angry, like, I just can't believe that they're making me quit smoking. Well, you have a choice. You don't have to quit smoking. And sometimes people say, well, I have to if I want the cheaper insurance. No, you can choose to pay that premium and continue to smoke, and no one will be the wiser. Nobody even has to know that you're paying a higher premium, because a lot of people, they go through, hoops and bells and whistles in order for people not to know that they're a smoker.
I remember my dad living in the anger stage for quite some time when his doctor told him he had to stop smoking because of his high blood pressure.
Mhm.
And I remember him coming home and being very angry because of the doctor sat behind his desk smoking on a cigarette as he told dad he had to stop smoking.
And see, and that's not a very effective way to help anyone. No,
No, it was
really.
not.
And we have here, they're angry about the loss of their friend. Part of the class of what I have people do is, at a certain point, is I have them write a letter, dear cigarettes. Write everything in there, how you feel, that you're going to be sad, that it's a loss. When we're in person, we have a group, we can look, I typically go around the room and everybody does a sentence or two, and we create this letter. And the things that come out, people are like, I'm losing a friend. I will no longer have this in my life. While I'm happy, I'm going to miss you. And it's amazing what people say during this, that their anger, their sadness about not smoking anymore, more so than the health benefits. Again, we have some of the typical feelings, being angry about everything. Why me? I'm mad that I started. I'm mad that I'm quitting. Looking at the, just the anger. And I've had people be angry in class, and then we talk about, why are they angry? So then we look at, just how to process that.
Mm-hmm.
That again, it's part of the grief cycle process. Accept it, vent it. And I tell people, this is a safe space. What's said in this room stays in this room, and let's use it. Let's see where we are going forward. We talk about bargaining, and this is where they're like, oh, I'm going to smoke less. I'm going to smoke the ultra lights. I'm only going to do this, or I won't smoke in my car anymore. And I've had people just kind of go back and forth between, anger, bargaining, and just looking at, I'm only going to smoke while I'm on vacation. I'll just light your cigarette. I'm going to quit as long as my weight stays down. I'm going to try, but I'm not making any promises. And, I actually appreciate when somebody says, I'm really not interested in quitting. Really not. And that's okay, because then we talk about, why do you not want to quit? I don't want to do it. I don't want to go through that. I like smoking. So it's just really about, when somebody says, I don't want to quit, well, why? Tell me why. Let's investigate that a little further. And again, just remembering that it's part of the natural quitting process, and it just helps us move forward. Because at some point, you're going to get tired of bargaining. You're going to get tired of only smoking here or only doing it this way. And then we look at, okay, let's get you back into control. Depression, it's sadness. Mm-hmm. You're getting rid of something that's really important in your life. And that's been a big part of your life. And so just, that's where we talk about doing the Dear Cigarette letter and acknowledging that this is an important part of your life that you are removing. I feel so emotional. I feel deprived. Why can't I have this one thing in my life? I feel lonely. And so then we talk about, okay, where are those feelings coming from, and how can we help you, move on from that? And, just acknowledging, yes, that you feel like you lost your best friend, that it's okay to mourn the loss of cigarettes. People sometimes will say, I can't believe I'm sad about not smoking anymore. Well, it's been a part of your routine. It's just like when we lose our favorite TV show because it suddenly goes off the air and it's not being renewed. It's like, oh, felt that last night after, the last episode of a show I'm watching. Oh, that was a season finale. But you move on. And eventually you get to acceptance. And acceptance, you can sometimes go back and forth there too. And acceptance doesn't mean that you're happy about it. It just means, you know what, this is where I am in life and this is how it's going to be. A lot of times people feel like, oh, I have to be happy about this. No, you don't. You simply just need to accept that I am a non-smoker and this is where I am. And that's where people start to realize I am no longer a smoker. Moving on through the sense of loss and grief and getting on with a new, healthier lifestyle. And sometimes people think like, so do I have to go out running now? No. Healthier lifestyle is simply that you are not smoking anymore or using tobacco. I think I'm going to do this. I still don't like it much, but I think it will stick. I like to smoke, but I choose not to. I think that's a very powerful statement. I'd like to smoke, but I choose not to. So out of all these, that's I guess if I have to have a favorite phrase, that one there means that one sticks out the most. Remember, your attitude towards quitting is the key to moving through psychological recovery. And a lot of times people don't realize that it's more than just a habit. It becomes part of everything that you do. And it's part of how we feel and how we perceive others, what we want in life, where we go, what we're thinking of. I know of some people who don't travel because, getting on a plane means I can't smoke. And, so just looking at quitting tobacco, quitting nicotine, and what are some of the keys of you moving through to the recovery and getting out on the other side. And sometimes people feel like, well, I'm giving up everything. No, you're giving up cigarettes, but you're giving up something that is very negative and bad for you and holding you back in a sense. So that we look at looking at what are the positives of being a non-smoker. And again, success is not final. Failure is not fatal. It is the courage to continue that counts. Like that, because it's just because, all right, I quit today. It's something that is ongoing.
Yep.
And it takes courage to say, I need to quit. Yeah. So the things that we've learned today, identifying various nicotine cessation interventions, group and individual approaches, the 3 A's: avoid, alternatives, adjust. And then, I like to ask, what is something else that someone has learned at this, as another way to get through and become a non-smoker. And if there's any questions, to reach out to me and I will get back to you with what I know and what I can. Please spay and neuter your pets, adopt a new best friend. All right.
That's awesome, Sonia. Thank you so very much. We greatly appreciate you sharing your time and your expertise with us. Being the daughter of a smoker and losing my dad to small cell lung cancer and having several family members who have since quit, watching from the outside of seeing that struggle, this just really helped make it a lot more clear to me as a non-smoker of what they were going through in their effort to become a smoke-free lifestyle. So thank you for this.
You're very welcome. Thank you for having me today.